Good afternoon, everyone. Hello. Welcome to today's panel on London Global Cancer Week on bridging medicine and emotional support in cancer therapy. It's really nice. I know that people are just joining us, so I'm going to have a very slow start so that people can join us as they log into their computer. Well, my name is Laura Fernandez Diaz, and I'm a senior manager at the Union for International Cancer Control, an international NGO based in Geneva. And I've been asked to moderate this panel, as I was saying, on bridging medicine and emotional support in cancer therapy during this London Global Cancer Week. So welcome everyone to today's virtual panel. The panel is hosted by the Children's Cancer Center of Lebanon, CCCL, that is a reference center of comprehensive childhood cancer care in Lebanon and in the region. I will be, as I said, your moderator in a session that focuses on the vital role of mental well-being in cancer care. Our speakers will share their personal stories, insights, and experiences on the benefits of comprehensive patient-centered treatment that combines medical and mental health support. We'll explore the physical, emotional, and social challenges that cancer patients face, the importance of expressing emotions during treatment, and the power of partnerships in supporting patients and their families. Obviously, in times of conflict, the role of emotional support in cancer therapy becomes even more crucial. CCCL and other cancer organizations across the region have been beacons of hope for children, their families, and caregivers impacted by cancer. Today, we'll hear from diverse expert voices on psychosocial support and therapy. I want to highlight one common quality among all our panelists, which is their youth and their unique expertise along different stages of the cancer journey. Joining us today, we will see wellness experts, a music and play therapist, a pediatric oncologist, a yoga teacher, a representative from the private sector supporting this important work, and a person with lived experience. I'll introduce each panelist briefly before their interventions so they can share their insights on the childhood cancer journey. Some will present the slides and others will just share their stories directly with you. Please feel free to type your questions in the chat and we will address them after hearing from everyone. So don't hesitate, don't be shy, and use the chat option. Without further ado, I think let me introduce the first of our panelists, that is Ms. Aya Kandour. She's a 25-year-old psychology graduate from the American University of Beirut. And well, sorry, we saw a slide with some of the rules of please keep the microphone muted. And as I was saying, type your questions that we will address in the segment of Q&A later on. So again, with Aya, Ms. Aya Kandour, a 25-year-old psychology graduate from the American University of Beirut, with a minor in theater and creative writing. She's currently pursuing her master's degree in clinical psychology at Holy Spirit University of Kaslik. Aya works as a programs officer in the wellness program at the Children's Cancer Center of Lebanon since 2022, where she supports the well-being of young patients undergoing treatment. So Aya, the floor is yours.
Thank you so much. Hi, everyone. My name is Aya Kandour, and I'm a program officer at the Children's Cancer Center of Lebanon. And I'm here to talk to you about the wellness program that is at the center. At the beginning, I would like to address first the mission and the vision of the center. So the mission of our center is to support all children with cancer and their families by securing funds for accessing to standard treatment regarding of the parents' financial situation, excellence in psychosocial services to help fight the disease, and education to create better understanding and awareness of the disease. Our vision is providing access to free standard treatment and care to all children with cancer in Lebanon and the region without any discrimination. Also, the Children's Cancer Center, next slide, please. Also, the Children's Cancer Center has treated over 5,000 children since 2002. It treats also 50% of childhood cancer cases in Lebanon, 400 children per year, treat all age group from 0 to 18 years old from all races and nationalities regardless of any background and parents' ability to pay. The cure rate exceeds 80% and in some types 92% for leukemia. We need a yearly budget of $15 million every year. And we treat children in 7 hospitals, covering around 90% of Lebanon, including ABMC and other hospitals all over Lebanon in the north and the south as well. In addition to the wellness and psychosocial program, the CCL has pedagogic program and a survivor club called the Champion Circle since 2018, and a pediatric palliative home care service as well. I'm going to start now with the wellness program. So the wellness program first debuted in 2012, but it became a full and complete program in 2019, where we offer 600 sessions every year. It includes sessions like art and craft, expressive music, drama, yoga, expressive music, and an eye wall and rehab wall for physical health, which are screens where kids can actually play and do some physical like movement, but they're very minimal because we're just taking care of their health and we're scared that they could do anything that could make their well-being worse. So we just make sure that their movement are very minimal. The benefit of this wellness program is to improve, firstly, their self-esteem, to reduce any negative emotions and the level of their stress and pain. Also, to sharpen their balance in some of their activities. They acquire new skills, artistic skills. For example, in art, they acquire the way they draw, and new musical skills in music. It improves their creativity. And of course, any artistic activity is also one of its benefits is to have fun while they're waiting for their treatment that could go around from 2 hours to 6 hours, depending on each patient. So they can, but while they're waiting, they can actually participate in an activity and enjoy their time. They also, it helps them face any daily challenges by strengthening and motivating them. They also are able to connect with other kids and share their experiences with cancer. And finally, be more aware of the space around them and more in touch with their body. Before I continue to the next program, I would like to share a beautiful story of a patient at our center called Mustafa. Mustafa, the first time I've ever seen him was literally in a wheelchair with both of his legs uh, sorry, with both of his legs unable to do anything. His legs
So was
injured.
paralyzed, you mean?
Yes, paralyzed, exactly.
Uh-huh.
Not fully paralyzed because they were just in bandages and they were like, he couldn't move and he lost his ability to walk due to cancer. Okay. So, as the wellness team and as a part of the wellness team, it was our duty to make sure that this child would actually receive the best of treatment, not just medically, but also psychosocially. Every day, myself and the wellness team, we would come to him and we would try to convince him to participate in one of the session, to enjoy his time at the hospital, to make friends, to share his experiences, to explain to us what he's feeling, if he's feeling, but he would refuse. He would stick to his mom and he wouldn't want to move. He wouldn't even make eye contact with us. He wouldn't even look at us. He wouldn't even answer any of the question. But that's one part of our job. Every child at the center has trouble fitting in at first. It's not easy. It's not like going to school. It's something way harder than that. So every day, even if he says no the first time, we never stop. Every no means a yes in the future. So we keep on waiting and trying and trying and trying. With us and the wellness team, we kept on trying until one day, Mustafa decided to enter a drama session. And the drama session, as we know, we need to use the body to move and to act and to express our emotion. However, Mustafa, regardless of his injuries, he was able to do the session fully, like any other child at the center. And it had made him so happy that I've never seen Mustafa smile this much. And a few months later, he kept on going session after session, trying all the sessions at the center that I just mentioned before. And Mustafa, from being unable to walk, was able to stand up. A few months later, Mustafa was able to walk. And Mustafa currently now, a few weeks ago, he rang the bell, which is a symbol in our center, is the symbol that he finished his treatment, to announce that he finished his treatment, and is now not just being able to stand up and walk, but also free of cancer and able to run free. So this is Mustafa, and this is like one story that kind of explain and portray what we do and a part of what we do at the Children Cancer Center in the wellness team. Moving on now to the next program, which is the pedagogic program. So the program has started in 2022, but before I talk about it, I want to talk about another program that is for older children that are also cancer patients at our center, and they're studying for bigger exams, like the official exam, like the baccalaureate and the brevet. So we have volunteering teacher in this program. They volunteer and they come and teach those kids those specific exam, practicing those exam, practicing anything school related. So when they reach the official exam due date, they are able to do them with ease. And those official exam are also take place in the hospital, and it is under the Minister of Education. So they come to the hospital like any other kids outside of the hospital. They take the exam and perform with the same exact way. As for the pedagogic program that we have at the center, we discovered that after seeing the older children graduating and doing great in school, we discovered that some of the children, because of their treatment, had to leave school or never were able to enter a school. So we decided to do this program that is not a replacement for the school, and it's for children from 3 to 8 years old, and it helps facilitate the entry of school after their treatment is done. This program it also follows the curriculum of the Ministry of Education, and it includes pre-math, pre-writing, English and French, and Arabic. Its benefits are for all the skills offered work for one purpose. We all work for one purpose in this program to facilitate, as I said before, children's integration at school. For the pre-math and pre-writing benefit, they understand and learn different shapes, colors, notions, and matching items together. They are able to differentiate the sizes and weight of objects, and they understand the numbers and able to sum or subtract numbers together. As for the languages, Arabic and English and French, they learn to develop motor and cognitive skills, easier to integrate in society by being better at expressing themselves, and more curious and uncover more about their identity. Finally, we're going to talk about our most recent program, which is the virtual reality one. The integration of the virtual reality to our program started in 2023. Virtual reality is one of the newest therapeutic tools used at the CCCL, designed to immerse children in calming and engaging environments, helping them manage anxiety, pain, and emotional stress. So far, the VR has been used to distract children from pain procedures, immerse calming experiences, encouraging meditation and mindfulness, and finally, what we discovered actually as an additional benefit is to make some of the dreams of the children virtually come true, which means I'm going to just give a brief example about this. Kids, when they undergo their treatment, they are restrained from going to places or visit places just for their safety and because their immune system is very low, different than other kids. One of the most known place that kids always nag they can't go because of their treatment is the beach. Beach has a lot of bacteria. They could actually not swim anymore for the time they're under their treatment. So basically, through this virtual reality, we can actually transport children from a hospital room to a beach, a virtual beach, where they can actually just be familiar to the experience that they're wishing, like they're going to be familiar and happy to see something, even if it's not real in front of them. At least it's the closest thing they can have for now, because later on when they finish, they can just go back to the beach like normal. So we tried it on children and they were so happy after this experience that the smile also never left their faces. The benefit of this program is so far more than 100 children have benefited from the VR sessions at the CCCL, with plans to extend the program further. Observation has shown significant emotional benefits such as First of all, reduction of anxiety. Patient will feel feel calmer before procedures. 82% reduced reduction of anxiety. Pain management. We have distraction through VR. So during their treatment, when they're getting their injection or anything, we discovered that it's a great distraction because 97% have a reduction in pain during all treatment. And finally, emotion engagement. Children feel less isolated as they are transported into playful and adventurous world, and this is seen as 92 reported feeling less isolated and more engaged. Before I end everything, I would like to give a big thanks to PepsiCo. They have been our long time partner supporter since 2013, and they were supporting our Path of Joy ceremony, which is a graduation ceremony for all kids that are they succeeded and finished the baccalaureate degree or the brevet degree. So it's like any other celebration ceremony where they get diplomas and they get to celebrate this joy with everyone else and their friends. Thank you so much, and I can't wait to hear your question later on.
Thank you so much, Aya. Thank you for talking us through the wellness program in CCCL, and also to bring us a little bit the beautiful story of Mustafa and all the great work that was achieved with that, and for taking us a little bit to the beach in the through the VR experience. I'm gonna introduce you to the next panelist, that is Ms. Maha El Kurdi. She's a Jordanian music therapist. She's currently working as a music and play therapy coordinator at King Hussein Cancer Center. As you can see, graduated from Berklee College of Music and interned at the Children's Hospital in Los Angeles. As she says in her own words, passionate about people, music, and science. Maha seeks to harness the power of music to facilitate self-expression, self-empowerment, and a sense of community. Maha, the floor is yours.
Thank you for that introduction, Laura. Hello. As Laura said, my name is Maha El Kurdi, and I am a music therapist working at King Hussein Cancer Center in Jordan right now. In this presentation, I'm going to focus on the psychological support that we provide, but I want to mention first that this is part of a larger psychosocial department, and social work is a very, very vital and important part of it, and it's the reason that refugees, people from different backgrounds and ethnicities and socioeconomic levels can access care at an equal level. And let's begin with the psychological support. Thanks. So specifically within psychological support, we have clinical psychologists. We use expressive arts therapies, and I'm a music therapist. And we have lots of programs for activities and for children's just general well-being. And these activities and these services are provided for different age groups within pediatrics. So it's from ages 0 up until 18, and some patients are even older. The basic main purpose of psychological support is to relieve patients and families of the stresses that they are experiencing, to empower them to go through these experiences, and to enhance their overall quality of life. And our approach is person-centered and family-centered. So we're not just looking at the person themselves, we're looking at the entire family. And we want to make them feel like they have a voice, they have a say in what is going on with them, and we want to make them feel capable in continuing and being resilient. Next slide, please. So at the most basic level, psychologically, what we aim to do is to normalize the hospital environment. This is what activities a lot of times do. So there are these spaces where children come together and they join in this mutual activity that encourages to express themselves and be themselves and just exist as children. We have some playrooms in the inpatient areas, and we have a playroom in the outpatient area as well. And these are spaces where children can come in and feel safe with the staff that is there, and even the volunteers that are there, and engage in many different activities. And what this creates is an environment. It changes the environment from one that where children are isolated or potentially withdrawn, and it encourages them to participate socially and express themselves. It changes the environment from being potentially boring to the patient to being very playful and very fun and engaging. It turns their fear and anxiety into a sense of emotional safety and even like excitement sometimes. It makes the place a little bit more familiar. It creates a more creative and welcoming environment. And it even, affects the sensory input that these children are getting when they're in the hospital. So instead of hearing noises and like machines, maybe they're hearing music. And instead of seeing blank walls, caring for the children, and they're seeing art. So it just generally adds an extra touch of humanity for every single person that walks into the hospital in the pediatric sections. Next slide, please. Next slide, please. Okay, thank you. And then on top of that, we get into distraction and wait, no, back. Yeah, okay. Next up, we have distraction and relaxation. So this is what I work on in music therapy sometimes. Sometimes clinical psychologists also work on this. Distraction and relaxation are very important techniques that we use for different ages to aid in managing pain, like tolerating discomfort, tolerating very uncomfortable and difficult experiences that are hard for everyone, but especially children who don't necessarily understand what's going on, of different ages. So, and this is helpful not just for the child, this is also helpful for the staff. So during nursing procedures, if someone's being given a needle, if a device needs to be changed, a lot of times the children will put up a fight. They don't want that. They don't want to experience the pain. So having a small distraction can aid and ease and catalyze that medical process. And sometimes relaxation can be so powerful that it can replace, like literally replace a sedative. Yeah, so I have a story about this. I have two stories actually. One is here at KHCC and one is in my internship at CHLA. So the one that happened here is that, so this is specifically for pain. There was a patient, 12-year-old male, and he was taking chemo, and the chemo was burning his leg, and it was causing a lot of pain to his leg. And this pain has been lasting for like a couple of days. And he really felt like the chemo was burning his leg, and he described the pain in a very visceral way. And when I first came into his room and I asked him what level is your pain, he rated it at a 9 out of 10. With music, I came in, we played some familiar songs. We used like some techniques that, I learned in music therapy, and towards the end was so far away from the pain. And then when I brought back the conversation to the pain, I asked him, because, during this time there was laughter, there was talking. Towards the end of that session, I asked him, okay, how are you feeling now? How does your leg feel? And he completely forgot that there was any pain at all. He rated it at a 0 out of 10. So it went from a whole 9 to 0. And the other story is at CHLA, there was a patient. She was a 6-year-old girl. I had never met her before. This was my assessment session with her. She was screaming because of just a lot of pain, and her mom asked the nurses to get some Valium for her. But with music, she was able to breathe, avert her attention from the pain, relax, until basically she fell asleep and didn't need to take that medication anymore. Yeah. Okay, next slide, please. Next slide, please. Okay, thank you. And this is where we get, this is where we get a little bit deeper. So obviously this is a challenging experience for all kids. And we need to find their strong points, work with them, sometimes in a clinical sense. And they need to develop like important psychological resilience skills. And most importantly is probably emotional regulation. So that's just the awareness of their emotions and thoughts, being able to communicate them and express them. And this looks different for each age group. Yeah, thank you. Okay. We want to empower them to be able to go through this experience on their own. So an important story is there was a girl called Sumitra. She's a 10-year-old girl who was a new case. She was going through her second or third round of chemo, and a clinical psychologist walked past her room, and Sumitra just like, she seemed kind of withdrawn. She wasn't very interactive. And when the clinical psychologist was encouraging her, telling her that she is strong, Sumitra disagreed and said that she feels very weak. And with music therapy, she was able to kind of go through all of the emotions of that. It turns out that Sumitra loves writing. So in a way to explore her emotions, we ended up writing a song together. And through that song, she explored feelings of anger, fear, but also determination. And by the end of 2 sessions, and that's all it took, we had a whole song that she was very, very proud of. She felt empowered, and she wanted to share her story with other people. And she ended up like having her last chemo session and going into remission rather quickly, like just within a few months. So that is a very cool story, I think. Yeah, and importantly, also the continuation of healthy child development. So these are growing children. We don't want their lives to stop just because they have cancer. And that includes continuing their education. We have a whole team for that. As well as like physical development and emotional, cognitive, and social development. Okay, next slide, please. And expressive arts therapies specifically are so vital when it comes to nonverbal communication. Me as a music therapist, I can work with babies who are under 2 years old. When I go into a patient's room and their heart rate is really high, they're crying, that is affecting their metabolism. They're expending more energy than what is useful for them. They need proper nutrition, they need proper vital regulation. And music therapy is very effective in doing that. Other cases such as children who have autism or special needs or speech issues or are simply just shy or fearful patients, expressive arts therapies are incredibly effective in working with those children. And we've seen amazing results. Okay, next slide. And finally, I just want to talk about end of life and grief. So specifically, at end of life, especially with a child, there's a lot that goes on with the parents. A lot of support is needed. And that is not just like psychological support, but also spiritual, religious support. Social support is incredibly important. And in music therapy, what's special about music therapy and other expressive arts therapies is that art as a concept always has meaning and always has some form of creativity and self-expression. And it helps parents and patients find meaning during this time of sadness and grief. And it ensures that instead of going into a state of like dullness and depression, that people are able to allow their emotions to flow and to create something that is meaningful. And we do that through legacy projects, which means like little projects that can stay with the parents that have a bit of their child in them. It facilitates family bonding. And it also just makes the whole family feel much more at ease within the hospital and much more accepting of everything that is going on. Is there time for a story or not really?
I think, Maha, we will have to wait there.
Okay.
Maybe after
Well, thank
we
you
will have a
for
little bit more
listening.
of time. Thank you so much for sharing all this incredible experience that you have with music therapy. It's really amazing. But I think we need to now go to the next panelist. That is Dr. Rahida Dehaney from the head of pediatric hematology oncology unit at the pediatric program director at Hamoud Hospital, University Medical Center. Dr. Rahida, she is providing us today the point of view of a physician in her work with cancer patients and the importance of emotional support in cancer therapy. Dr. Rahida's aim is to treat patients with benign hematological disease and cancer all over the South region in Lebanon. Dr. Rahida, very nice to see you today.
Thank you. Nice to see you too. Thank you, everyone. I would like to thank CCCL for this beautiful gathering. Okay, so I would like first to share my medical point of view regarding the importance of psychosocial standards in the treatment journey of patients with cancer, especially children with cancer. And then I will talk about what I do regularly when I meet a new patient with cancer with him and his family. So in 2015, an interdisciplinary group of psychosocial experts developed the standards of psychosocial care for children with cancers and their family. And at that time, the paper presented the data for national survey for pediatric oncology, social workers, and their experience in delivering psychosocial care to children and family by addressing the adaptation to the cancer diagnosis, treatment, and transition into the survivorship and end-of-life care and bereavement. It contains 15 standards. I will go over them rapidly. Next slide, please. So the first standard is the assessment of psychosocial need using the either two tools, the psychosocial assessment tool, which is widely used, or the National Comprehensive Cancer Network District Thermometer. So this was the first standard, assess the psychosocial needs, and then move to the next standard, which is monitoring of neuropsychological outcome in children with brain tumors or neuropsychological deficits resulting from treatment. These patients, this special subgroup, patients who have brain tumors, they will suffer a lot of complications or consequences because of the brain surgery that they undergo. So they will assess here the problems that develop during treatment or after completion of treatment. It's a special population. The third standard is screening for psychosocial functioning for long-term survivors. So please, next slide. So in this screening, they will look after end of treatment if we have any abnormal function for long-term survival by evaluating and treating the spectrum of late effects, and this will include routine monitoring for educational and vocational progress. Standard 4, next slide, please, is access to psychosocial support throughout the treatment trajectory. So this is during treatment, and this is to be provided by institutions or by the social workers that are working inside the institution, or as in our case, CCCL is providing this to the institution where they have collaboration with or affiliation in order to complete all these tools together and complete these standards. The standard 5 is the assessment of financial hardship. So even these psychosocial support should be also financially covered, and we should have financial screening systematically at diagnosis, during treatment, during survivorship, and in bereavement care. Standard 6 stands for the assessment of parental mental health needs. So in this standard, there will be systematic screening for parental distress upon diagnosis and during treatment. And in this case, sometimes we can offer inpatient psychiatric or psychological consultation services to the parents of children being treated for cancer, especially in, of course, acute cases or parents who cannot understand very well the situation. And also standardized assessment tools to assess the parental mental health is being used, either the patient health questionnaire or the psychosocial assessment tool, as we previously mentioned, that is widely used. Standard 7, next slide, please, is the education and anticipatory guidance for disease and treatment. Also in this standard, we as doctors, we encourage all the doctors or the healthcare providers or even the social worker or anyone who assists in providing the social support is to clarify for the patient and their family the importance of to explain the disease and the stages of the disease, the treatment phases the patient will go through. So it's related to psychoeducation, including the provision of resources, sometimes the book that are provided by some of the main centers worldwide that treat pediatric cancer, educational support groups, camp programming, and schedule of educational events. The 8th standard is the preparatory interventions for invasive procedures. So to explain to the patient and their family how are going to do his bone marrow procedure or lumbar puncture or intrathecal chemotherapy or bone marrow transplantation as well. The standard 9 calls for access to social interactions by including social opportunities, scheduled activities in the inpatient's playroom, the support groups, or planned annual hospital social. Sometimes it also includes the creative opportunity their institution they offer for patients and family to connect with each other. I will tell my own experience after I finish the standard this presentation. Social outlets including partnership with community agencies to offer camp, family retreats, bereavement supports group, and memorial services. Standard 10 stands for sibling support to promote sibling socializations and emotional support, especially when we have a deep connection between a patient and one of his sibling. For example, in case of twin, if we have a patient who are member of twins, one is a patient and the other one is supporting him. School re-entry support, as I mentioned previously, direct support to school and teachers to help the child transition back into the school system, and to choose an educational coordinator or social worker or child rights specialist to assist with school re-entry. The standard 12 calls for the assessment and monitoring of treatment adherence. If we have a problem with adherence that is noted, participant describe performing an assessment to determine patient and family barriers. And whenever the adherence or the adherence problem is noted, the intervention will include psychosocial approaches, referral to other psychosocial providers, collaborative approaches with nursing and psychology. The standard 13 calls for the palliative care and end-of-life support. So it will include the role of all to introduce the palliative care concept, especially when the cancer diagnosis became advanced or when pain or other symptoms became more severe. End-of-life care most often include an interdisciplinary team approach and partnership with community agencies such as hospices. The standard 14, resources for bereavement support following the child death, either by phone calls, mail cards, or even visits to the parents, bereavement support group counseling or annual marriage services or weekend retreats. And the last one is the provider communication, documentation, and training. So the social worker or anyone involved directly in the psychosocial support, they should feel that they are an integral part of the pediatric oncology team, and and whenever they do feel like this, their documentation in the medical record will be considered as important as other part or other members of the pediatric oncology team. For my experience at Hamoud Hospital, or even when I was a fellow, so I start with what I call a welcome coffee. So I see the parents, I sit with them, I offer them some coffee, and we talk about the diagnosis, what are the causes, the main concerns of the parents, and as for the patient, I offer him a favorite meal. So what is his favorite meal? Of course, not to bypass the guidelines, what to eat or what not to eat. And we have worked in the hospital along with the admission office, the social worker department, as well as the nurses, to include a new gathering in the hospital called Jalsat Wood. So this gathering aims to interact the parents, which is other, and the family with each other. And we were planning to start it by the start of October, but unfortunately, we had the abnormal situation and the war. So we hope that we will start it maybe next year. And I personally, after the child is dead, I really do a parent visit, and I talk to the parents about the causes, what was the medical problem or deterioration that led to losing or passing of the patient. Yeah, that's it.
Thank you
Thank
so
you.
much, Dr. Rahida. It was really interesting to see all these important standards that you mentioned, and obviously the person-centered approach to the whole journey of cancer really is so important. As you said, the medical aspect that you brought. We are moving on now with another panelist, that is Dima Asaf. And she's a yoga teacher, so we are hearing from a very different aspect. Yoga instructor, began her practice in 2008, and later specialized in teaching yoga for children and families. Known for a very dynamic teaching style, Dima has led sessions for both kids and adults. Since 2019, she has been working with the Children's Cancer Center in Beirut, promoting the benefits of yoga for health. And I understand, Dima, that you have a little exercise that you want us to do. So please, all our audience, to be ready to hear from you.
Yes, of course. First of all, I have a question for you all. Who did ever experience yoga before? Anyone? I see we have 38 participants, so maybe by raising your hands or something. Any experience with yoga? Aya, I can see her hand. Yes, no. All right. So, all right, Maha, thank you. So I encourage you to open your cam if you can. Okay. If you have experienced yoga before, or even if you didn't, after around 40 minutes of sitting in our chair, I guess we all need to move just a little bit, just a few seconds. So let's, you can stand up if you wish. We're gonna inhale and raise your arms up, interlace them, and just take a deep breath up like that, and exhale. Oh yes, I can see like the exhalation through the mouth, as well. Inhale one more time, and exhale. We cannot hear you, so just don't be shy. Just exhale whatever stress you have in your body. Inhale last time. Exhale. And all right, you can stand up a little bit and shake, move a little bit. Just shake your body, shake your legs. And you can even put your hands in front of your knees and just make sure you can tap. Just make sure that the blood circulation is smooth and easy. All right, thank you. So now we're gonna put our hands on our shoulders, and we're gonna just inhale, make some circles with our elbows. The slower and the biggest the circles are, the more massage we feel in our shoulders. I can see some smiling faces. All right, everyone, and we can reverse this motion. Last time, make it count with a smile on your face and relax. All right. Thank you. How does it feel? Quickly, everyone, you can unmute, just say, cool.
Really relaxing. Yeah.
How many seconds
Wonderful.
was that? Anyone knows?
It was
Around a
about
minute. Yeah.
Yeah, less than 1 minute, right?
Yeah,
So,
about a minute in total.
yeah, just imagine what a 30 minutes can do, what a session of 30 minutes can do for our children who are fighting cancer and who are in really need to move their body. So this will take us to the yoga part, the beautiful thing about yoga. I appreciate and I love what Maha and Aya were talking about, the self-esteem, the relaxation, the empowerment, and this is beautiful. This is what yoga does, but at the same time, there's something very special about yoga because like yoga means like the physical exercises. These children, they come to the center, they know that there is something already prepared for them and they don't have any control over the procedures or even their body. But during the yoga session, they try to get this control again on their body. If they move one hand or they open it, now we're gonna see more examples. This is already a beautiful achievement, and there's someone there for them, and they are seen as well with these small motions, small progress, and I guess this is beautiful, and this is what's making them come back for more yoga sessions. So let's start with this first slide. Actually, what you see in front of you, I'm just going to be quick over. I'm just going to take you on a journey with these photos. This second photo with these children opening their arms very wide. Maybe if you look at it, oh yeah, all right, cool. But you know what? When we have stress and fear, when you are stressed and fearful, how did you ever notice how your body reacts? I'm sure no one is opening their arms up like that wide, right? So for our children who are fighting cancer, we notice like they are always like closed, they're closing their arms, they're just shrinking. And during the yoga session, even for a few minutes, they just relax and open up, physically open up their arms. And this is already something beautiful for them. And when they open up a little bit and look up high, their upper back is already more relaxed and more open. And this this can help them with the posture of their body. Versus the iPad and the iPhone, they're always like looking down, and we all know from the psychological point of view, it's not really working well for our psychological well-being when we're just looking down all the time. It reflects on our emotional well-being and health. So thank you. Next slide, please. So this one is very important, by the way. These tools that we use during the class, you might see like pom-poms, and yes, we can do like movement and some noise and voice and whatever. But guess what? During yoga class, especially, this will become an extension of their body part, and this is so empowering for them. You can see them like lightening up and smiling, and the most like this is one of the most favorite game for children, especially those who cannot really move well. So they see like, you know what, I can do like more voice, more noise, and they can feel more free, and this is already amazing. Thank you. Next slide. I'm just going to go through them. Next slide, please. All right. So we're talking here about breathing. We can breathe with tools as well. Like and what they gain, these children, what they gain, what they take away from, what they take with them at home or to their home, is that they learn that they only need their body and their breath just to calm them down. We learn that, yes, we're using some tools just to make them more like interactive and interested, but at the end of the day, they know that closing their eyes or just using their hands and their breath can make them feel like a bit more relaxed, just a little bit, just even for a few seconds. Thank you. Next slide, please. All right, so play as therapy, as joy, and joy as emotional release. Here, two important things. One, first thing, I guess Maha mentioned it before, that they're back to being kids again. So even for a short period of time, they just forget about everything. They're just into the game. And also one more very important thing, using these cards, these or other cards as well, they pick a card. They pick a card and we go for a journey. And on these cards, there are things that they can pick. And they are the ones who create their journey. And this is already very empowering. And whatever they get on these cards, they do like movement, etc. And one more thing, at the end of the game, when we ask each child which one was your favorite move or pose, everyone, they choose, like almost everyone, they choose their own card because they feel the leader, because they are the leaders with everyone else. They feel they have a say. They come to the center, just like we mentioned before. They come to the center. They have no say in whatever treatment they're gonna have. But here, they're gonna be the leaders, and they lead their friends. Thank you. Next slide. Well, every yoga teacher, if you ask them, like they would say, like, they would talk talk about the grounding exercises, stability and balance, etc. But the thing is, during these exercises, sometimes it's a bit challenging for others and not challenging for some, whatever it is. But I'm using the word grounding exercises here as they are grounded in their body, and they take care, like they listen to their body. We all say, like we all know, like we need to be like we need to listen to our body. Whatever my body can do today, maybe it can do something different tomorrow. And also they see others. When they see others, this child, like this friend, he or she cannot move like really well today, but it's okay, maybe tomorrow. So they know they're not the only one. So they're just like this stability and emotions, like emotional stability. I don't know what we call it, but we call it like, it's okay, I'm fine, I'm not the only one. Everyone has to experience a lot of things, and it's just like ups and downs, and it's fine, I'm fine. So thank you. Next slide. We're almost done. We're almost there. We have some, yeah. So I would like to share some success stories. For example, last week, I had a boy called Karim. He's not the one in the picture, but it's very similar to this. While moving, while playing, actually, he could open his leg, and he was working with his parents and with a physiotherapist to open his leg, and he had this fear, he cannot open it. But during the game itself, he was opening it, and like there's no fear, nothing. I'm just gonna do this and that, because we were going on a journey, and he was the leader. So that was really beautiful for everyone to witness. His sister was there, and she was like so touched as well. Another success story.
Dima, I'm just gonna quickly, because we are really reaching towards the end of the session.
Yeah.
So if you could please just be briefly closing your
Sure.
yeah.
Sure. So these pictures, it's just like, I mean, like, the muscles that are moving, like children, they feel their muscles while moving them. So it's just creating hope, because we ask them, what would you like to do after the treatment? And they know that they are now building muscles without the pressure on their body, for a better, like for after the treatment. So building hope, I guess, is a key in this. So yeah, thank you so much.
Thank you so much, Dima. Sorry for interrupting you. This is a topic that, of course, we could be speaking for so long. But we only have 1 hour, and we are reaching the end. I'm gonna invite Ms. Rona Halabi to join us in the panel. She's the head of communications for PepsiCo in the Middle East. She's the head of corporate affairs, and she oversees public relations, media relations, crisis communication, She's instrumental in developing corporate affairs strategies that enhance the company's reputation and foster partnerships with government officials, regulatory bodies, NGOs, media influencers, and agencies. Additionally, Rona leads the PepsiCo social impact programs and executive and leadership communication efforts in the region. Rona, we are reaching the end of the session, but please share with us that the importance of a partnership in supporting this important work.
Sure. Thank you so much, Laura. I appreciate this opportunity to talk very proudly about our partnership with Children Cancer Center in Lebanon. I think, when we think as a company, as, which partners we want to work for, we are thinking about impact. That's the first thing that we think of. How can we create impact and support the communities that we are present in? So our partnership with the Children Cancer Center started a while ago. I think it's more than 10, 15 years maybe now. I only joined PepsiCo recently, but I was very proud to know about this partnership, and I'm very happy that we are able to continue with this partnership moving forward. And we all know the healthcare challenges that we have in Lebanon and how many families struggle with the high cost of cancer treatment, etc. So we have been supporting the work of the Children Cancer Center, which we know provides, life-saving cancer treatment. But as we heard from the speakers and the panelists as well, it's not only about the treatment itself, it's also about mental health care, if I may call it that. So we have been, for example, sponsoring the yearly graduation ceremony for children who have, are graduating, who are patients or who have already finished their treatment. So this is something that we do annually. But we also support other activities, and we can go to the next slide, please. We support other activities that also are very, very important for the children's mental health and psychosocial support as they go through that journey of treatment. So just let me give you very quickly a few examples. I know we're running out of time. So for example, we discussed with the Children Cancer Center, what are the things that we can do to continue to support the children in that journey. And one of the ideas was to get these VR headsets, which, they provide an immersive experience during treatments, which hopefully will help make things easier for them. We also contribute to the psychiatry and nutrition consultations for the children and their parents as well. And we also support the palliative care programs, so that just supporting the center to offer that emotional, psychological, and spiritual support, and all of these great activities that the panelists have taken us through. I think, the last thing I want to mention is the impact on the people of PepsiCo and more largely society, because we know that, what we are doing is definitely, supporting the center's efforts to help these patients. And we know that this would enhance their quality of life, hopefully, and, addresses their mental and emotional needs alongside their medical treatment. So we know this is very important for them, and we know it has a great impact. But I think the impact that we have seen also on PepsiCo people who have taken part in volunteering activities at the Children Cancer Center, I think, even like if you ask anyone at the PepsiCo office in Lebanon, they will tell you about these experiences and how it was inspiring for them and how they actually learn from these children so many things during these engagements that we have, whether it's during that graduation ceremony I told you about at the beginning, or also through some sessions that, we took the time to go and spend some time with the children at the center, doing some activities, doing some storytelling. And, every associate that takes part in these activities speaks about how inspiring that experience has been for them. So I really wanted to highlight that and how important that is for us as PepsiCo, but also more largely as a society. Thank you so much.
Thank you. Thank you so much, Rona. Yes, I completely agree with you. An impactful partnership is one that there is engagement both sides as well. So it's really incredible to see that happening in PepsiCo. Please stay with us a little longer. We have a final panelist and just some closing remarks still pending. I want to just go straight to Mr. Charbel Hawa. He's a 22-year-old graphic design student at the American University of Beirut. He was diagnosed with leukemia in the late 2012 and underwent chemotherapy for 3 years at the Children's Cancer Center in Lebanon, finishing in 2016, which made him 8 years cancer-free. Please, Charbel, share with us some of your insights.
Hello, Ms. Laura. Thank you for the introduction. Good afternoon, everyone. Thank you for joining us today. I'm really honored to be speaking and sharing my experience on behalf of the Children's Cancer Center. And to be honest, I'm going to start by saying I am so glad to remember, although I had childhood cancer, and I'm glad to remember it by all of the activities and care that was put towards the patients like I was myself, that I still remember after I finished my chemotherapy, and it still stuck with me and helped me basically to shape my personality right now. I remember that I used to go and I used to withdraw blood and wait for the results, and the CCCL didn't allow us to to even think of this whole experience all along. They thought of every single second of it. They got so many volunteers to come over and help us to do arts and crafts, and they used to bring a lot of teachers that can help us with music and everything, and keep in fact so I had all my experience before the wellness program started. So I'm thankful that they had supported us from the beginning before even starting the wellness program. And I'm so grateful for every single person who supports and funded the Children's Cancer Center to raise the spotlight on this very important part of the patient's life during taking the treatment. And this is all I'm gonna say so I don't keep you all late or anything.
Thank you so much, Ahmed. Not a problem. It's always so important to see as well, from your point of view, that you went through the journey, that you can share your story. So that's always so important and impactful. Thank you so much. I think I'm gonna give the floor to Imad El Hajj, that from the Children's Cancer Center, for some closing remarks, because we really had such an interesting panel that we completed the hour, and unfortunately we won't have time for questions. But I hope that for all the audience that are interested, that you can reach to the panelists through CCCL, through the London Global Cancer Week. I'm sure that we will be able to answer any questions that were pending. So Imad, without further ado, closing remarks on you. Thank you.
Hello everyone, it's nice to see you all. It's a great panel, great panelists, great experience sharing. It's something that I can summarize in 3 key points that you all tackled. The first one, which is the patient-centric approach, regardless of any situation that the country or organization or the patients. We've seen that approach throughout the journey, cancer journey. From diagnostic with Dr. Raghda to implementation of programs to end of treatment. It's one of the approach that the CCCL is always considered when enrolling in new patients. We've seen the work that CCCL is doing throughout the years. Then the second point is the importance of partnership with NGOs, and that's demonstrated through the continuous support of our main partner, PepsiCo, and other private sector partnerships that allowed a great institutions like CCCL, and I'm sure KSCF has the same partners that allowed us to provide this treatment free of charge. And finally, the third point, that without the first 2 points, it could have hindered all efforts, which is external environment causes that is out of our hands. It's uncontrolled by any organization or parents, and we've seen that the other two main points have allowed us and other NGOs, other institutions to overcome any difficulties. Finally, it's always been a pleasure to see survivors like Charbel come to any panel or any events that we as a center organize and give this testimony that shows this great work that institutions and NGOs are doing in a country that is crippled with economic and other crises for 5 years, over 5 years. So again, thank you all for joining us. Thank you, Laura, for always jumping into our webinars to moderate. Thanks, Rosalia, for organizing. Thanks, everyone. Thanks, Maha. It's been great, like always, KSCF being with us in a region to advocate for a better cancer journey. Thank you all.
Thank you so much, Aymar, and everyone, all the panelists. It's a pleasure to participate in this webinar, and I think we shall continue the discussion in different platforms, because there is here topic for hours and hours. So thank you, everyone. Thank you all the panelists and CCCL for hosting, and we say goodbye now. Thank you.